For patients nearing the end of a serious illness, one form can determine whether their wishes are followed by every doctor, nurse, and first responder who treats them. Connecticut just updated how that form works. It's Section 192 of Public Act 2668, an update to the state's MOLST program. MOLST stands for Medical Orders for Life-Sustaining Treatment. It was signed by Governor Ned Lamont as part of the same large budget bill we've covered before, the one that also restructured Connecticut's hospital tax. The statutory changes took effect May 26, 2026, and the Department of Public Health issued new policies just 2 weeks later, on June 8th. To understand the update, it helps to know what MOLST actually is. It's a medical order, similar to a prescription, that documents a patient's wishes about treatment near the end of a serious, life-limiting illness, or during advanced, chronic, progressive frailty. Unlike a living will, it's meant to be immediately actionable, understood at a glance by doctors, nurses, EMS, and first responders. Connecticut's program actually started small, a 2015 pilot that served just 142 people across 13 facilities. It went statewide in 2017. Now, in 2026, lawmakers revisited it. Here's the first change. A MOLST is only valid if it's completed on the official DPH form and executed exactly according to statutory and regulatory requirements. That's a clarification meant to prevent confusion or disputes about whether an order was properly completed. Second change. Physician assistants can now determine that a patient's condition qualifies for a MOLST. Before, only physicians and advanced practice registered nurses could make that determination. Adding physician assistants to that list means more qualified providers can start this conversation with patients and families when it matters. Third change. Patients no longer have to hold on to the original paper form. Providers can give them a copy or another way to access the order. That may sound minor, but for families managing paperwork during a serious illness, it removes one more point of friction. Alongside these legal changes, DPH issued its own new policies just weeks after the law passed. Providers who want to execute a MOLST must now complete DPH-approved training first, with no exceptions. That training focuses specifically on the conditions that qualify a patient for the program. DPH's policies also require something important. A provider has to actually have a MOLST discussion with the patient or their legally authorized representative before completing the form. In other words, this is not paperwork filled out in isolation. It's meant to follow a real conversation about the patient's wishes. To be valid, a MOLST form still has to be signed by the patient or their representative, the treating provider, and a witness. Once completed, it can be honored by hospitals, EMS, long-term care facilities, and home care providers alike. The idea behind MOLST rests on two principles: respecting patient autonomy and making sure a patient's wishes are actually understood in an emergency. Interestingly, this same budget bill also set aside $30 million for an entirely unrelated program, a new state-run student loan initiative. It's one more example of how much can end up bundled into a single piece of Connecticut legislation. But for patients, families, and healthcare providers dealing with serious illness, Section 192 is the part that matters directly. As of May 2026, Connecticut's MOLST program requires the official DPH form, allows physician assistants to determine eligibility, lets patients keep a copy instead of the original, and now requires provider training and a real conversation before the form is signed. If you or a family member has used a MOLST form, does this update sound like it improves the process? Let us know what you think, and if you learned something new, hit like and subscribe for more breakdowns of the laws shaping Connecticut.